My name is Michael Leavitt, and I practice in Sierra Vista, Arizona. I did the 48-week comprehensive course, and I also did the Aligner Plus course. I love that it was set up for the general practitioner so that you don't have to be put in a position that if you want to learn it and do it right, and not just do a weekend course so you know enough to get in trouble or to not really know what you're doing, that you didn't have to shut your practice down and go back to school in order to learn to do things right. Yeah, as a dental student, they kind of make orthodontics seem mystic, or they don't go into it very often in dental school. So it's really easy to be overwhelmed with the idea of trying to learn orthodontics, that it's shrouded as in only the elite specialists who go to school for it can do it. They basically make you feel kind of like you know enough to not even do it to scare you away from trying to learn it, so that you don't get in trouble or make mistakes. So it was a little overwhelming at first to take that first step, but once I did with Progressive, they really demystified it and made it simple to understand that any dentist can be doing it if they're taught properly. Good question. I actually picked up an extra half day during the week, and all the production I used from that is what I used to offset some of the decrease in production that I had when I started doing ortho cases, because it took away from my general dentistry a little bit. So I added a little more time in so that financially it wasn't as much of a burden. And I did the IAT course, and that limited the amount of travel that I had to do. Being in Southern Arizona, it wasn't a short drive to come over and take the courses. There are several courses throughout the country, but on the West Coast, it's California. There wasn't many options except here. So I did the IAT, which I learned was really good for me, because I learned that some of the things I learned really good listening to a lecture, and some things I learned really well being able to go back and rewind what was said to make sure I understood it. And so I found that it was a really good option for me, having some hands-on and in person, and then having some I could do at my own pace when I had more time. It's totally turned everything upside down. Coming out of dental school, a lot of it is you're looking at everything in tunnel vision as to this procedure for this tooth, this procedure for this tooth, really problem-based. Even though I was trained as a comprehensive dentist to look at everything as a whole, when it came to actually doing the dentistry, it felt like it was more piecemeal, that I was just treating teeth instead of the whole. Where now I look at the mouth totally different and my treatment totally different, having orthodontic understanding. Cases in the past I would have treated with an implant or a bridge or multiple crowns. Now, even knowing that, I know that some of those crowns that I would treatment plan aren't going to be as successful if I don't put them in ortho first, correct the deep bite. Now I have room to get more ideal restorations that are going to last the patient longer and give them better dental health throughout the rest of their life. So I have a much broader view of treating the whole mouth and all of its benefits, not just problem-related treatment. I recommend it to all of the doctors that I work with. I work in a practice with lots of doctors, and I've told several of them that they need to do it if they want to start doing it. And I think it's a fantastic program.